Hello everyone and Swadika from Thailand. I would like to thank the 9th Annual 3R Symposium Organizing Committee and the Center for Alternative to Animal Testing for the gracious invitation. I will demonstrate the success story how AAALAC International Accreditation process applies to the Asian environment to improve animal welfare and scientific rigor. AAALAC International is a non-profit and non-governmental organization. Established in 1965, AAALAC International has been the only organization that assesses and accredits animal care use programs for research, teaching, and testing around the globe for 57 years. Please visit AAALAC International website for further information. AAALAC International is the current official name, and it is no longer an acronym. There are 73 member organizations that endorse AAALAC International's missions, demonstrating their commitment to responsible animal care and use. Asian's member organizations include Asian Federation of Laboratory Animal Science Associations, AFLAS, Chinese Taipei Society of Laboratory Animal Science, CSALAS, Japanese College of Laboratory Animal Medicine, JCLAM, Korean College of Laboratory Animal Medicine, KCLAM, Laboratory Animal Scientists Association, India, LASA, India, Thai Association for Laboratory Animal Science, TALAS, and Singapore Association for Laboratory Animal Science, SALAS. 12 member organizations delegates, along with presidents and vice presidents of AAALAC International Council on Accreditation, serve on the board of directors, that is the governance body of AAALAC International. AAALAC International has 3 offices, and 1 office is in Thailand. Globally, there are over 500 international volunteer experts who conduct on-site evaluation on behalf of AAALAC International. There are 21 Asian members who serve on the Council on Accreditation, 2 council members emeriti, and 77 Asian ad hoc specialists. The value of accreditation. First, is a symbol of quality. It shows that an institution is serious about setting, achieving, and maintaining high standards for animal research programs. AAALAC accreditation also promotes scientific validity. When research involves animals, reliable results depend on healthy animals and superior animal care. Accreditation demonstrates a willingness to go above and beyond the minimums required by law and assures the public that the institution is committed to the responsible use and treatment of animals in science. Currently, there are 1,059 accredited institutions in 50 countries or regions. Please find more information of accredited institutions in Asia located under AALAC International website, Directories of Accredited Organizations. This table shows the total of 230 accredited institutions in the region. There are 93 accredited institutions in People's Republic, China, followed by 34 in Japan, 29 in India, 25 in Republic of Korea, 21 in Taiwan, 11 in Thailand, and 6 in Singapore. And the rest are in Cambodia, Indonesia, Australia, Malaysia, and Vietnam. Majority of accredited institutions are in the commercial sectors, followed by universities, nonprofit, governmental institutions, and hospitals. These graphs show the rising growth of accredited institutions in the Pacific Rim region since the first one in 1995. AALAC International used the same assessment process to evaluate animal programs in any country around the world. Revisit occurs every 3 years. At any point in time, approximately 98% of institutions are in full accreditation status. It means that 2% of accredited institutions, or about 20 institutions, are working on correcting or improving the animal care use program issues. The on-site evaluation is called the site visit by a peer review process. It is not an inspection. The site visit compiles information and makes initial evaluation. Several documents are reviewed on-site, and the site visitors visit the animal facilities and meet with personnel to confirm that the animal health facilities, environmental status, and procedures are suitable. The process is completely confidential. AALAC International applies the 3 primary standards and the Guide for the Care and Use of Laboratory Animals, National Research Council 2011, or the Guide, is the primary standard in Asia. For the programs that use agricultural animals, Council on Accreditation has adopted the Guide for the Care and Use of Agricultural Animals in Research and Teaching, 2020, or the Ag Guide, to be effective at winter 2023 site visits. In addition, the European Convention for the Protection of Vertebrate Animals used for experimental and other scientific purposes, Council of Europe, or ETS 123, is occasionally used in Asia. Similarity to other regions, AALAC International Accreditation System applies harmonization to local requirements in Asia. When there is no animal welfare law in the countries, the institution follows the Guide's recommendations. When some areas of animal welfare are not addressed in the local regulations, the institution follows the Guide's recommendations. If local regulations and requirements are specific and more stringent than the Guide's recommendations, the institution must follow the local requirements. Contents of the Guide in the 5 chapters set primary standards of all aspects of animal care and use program in Asia. In addition to the 3 primary standards, the Council on Accreditation has reviewed and adopted suitable international references called as reference resources. Council used the references for evaluation of animal care and use programs in all other aspects. The references are categorized to general biosafety, education, euthanasia, health monitoring, occupational health and safety, research-related, and species-specifics. For example, biosafety in microbiological and biomedical laboratories, the 6th edition, Centers for Disease Control and Prevention and National Institutes of Health, is used for evaluation of programs containing biosafety agents. All accredited programs in Asia follow the AVNA Guidelines for the Euthanasia of Animals 2020 edition. Accreditation ensures that institutions have adequate veterinary medical care program. In addition to the Chapter 4 of the guide, accredited programs follow the AAALAC International Position Statements and ensure that the attending veterinarians are qualified and have suitable responsibility. The AV is responsible for the health and well-being of all animals used at the institution. The institution must provide the AV with sufficient authority, including access to all animals and resources to manage the program of veterinary care. The AV must have sufficient authority to treat animals and to relieve severe pain or distress, including euthanasia. The AV should provide guidance to investigators and all personnel involved in the care and use of animals to ensure appropriate husbandry, handling, medical treatment, immobilization, sedation, analgesia, anesthesia, and euthanasia. In addition, the AV should provide guidance and oversight to surgery program and peri-operative care involving animals. In other aspects, frequently asked questions or FAQ topics provide information on AAALAC international interpretation and expectation. There are also several new FAQs regarding scientific reproducibility, poultry caging, swine housing system, dairy, calf housing and social enrichment, carbon dioxide for rodent euthanasia, HVAC measurements in agricultural setting, consistency in accreditation, managing and reporting adverse events. The FAQ, Scientific Reproducibility. What are AAALAC International's expectations? First, programs should consider scientific rigor and experimental reproducibility when evaluating animal research activities. The AWIC review should confirm that the protocol contains pertinent study design elements and ensure adherence to the principles of the 3 R's: replacement, reduction, and refinement. The review should include aspects such as the adequacy of the rationales for the use of animals, the purpose and design of the research, including randomization, blinding, and controls, the justification of species, and the proposed animal number. Moreover, it should also include consideration of the availability of alternatives to the use of animals, less invasive procedure, and use of lower species of animal, as well as the ethical use of animal under appropriate experimental conditions in housing environments. The AWIC should confirm that the program provides education, training, as well as direction or recommendation related to scientific rigor and experimental reproducibility to researchers and their staff, as well as the AWIC members. Guidance on various aspects of scientific rigors and experimental reproducibility may be found at ACD Working Group on Enhancing Rigor, Transparencies, and Translatability in Animal Research, ARRIVE 2.0 Guidelines, Experimental Design Assistant, Prepare Guidelines. Please visit AAALAC International website for the detail. In summary, areas improved by accreditation include essential occupational health and safety program, adequate veterinary medical care and authority of attending veterinarians on animal well-being, functional institutional animal care and use committee, appropriate animal housing, husbandry and management, consistent animal environmental standards. In conclusion, AAALAC International Accreditations assures quality animal care and scientific validity. Thank you. If you have further questions, please feel free to contact me by email montipg@aalac.org.